We've seen so many interesting stories and important data coming out this week that we couldn't cover just one thing. This is Healthcare Triage News. Topic number 1. Walmart opened a healthcare facility in Georgia recently, only the second of its kind. While the company has care clinics in some southern states, these 2 healthcare facilities in Georgia take up to 1,500 square feet inside the stores and offer everything from primary care to dental care to mental health care. They even do labs, x-rays, and health insurance, education, and enrollment. And true to the company's low-price ethos, services are provided at lower than average cost. A counseling session runs $45 per hour, compared to the typical $100 to $200 for an uninsured patient. Dental exams are $50. Annual checkups $30 for adults and $20 for children, and a visit for sickness or injury costs $40. According to an article in Forbes, care may be provided by medical and dental professionals already practicing in that community or by providers employed by Walmart. And while we haven't seen data yet on care outcomes or patient satisfaction, this could also be a viable option for patients who need help but might be lacking the resources, i.e. insurance and/or a lot of money, to get it. It also provides easy access to several services in one place, an attractive option for obvious reasons. Topic number 2. According to the CDC, life expectancy has risen in the United States for the first time since 2014. The average age of death in 2018 was reported at 78.7, the first upward tick since the average of 78.9 in 2014. The leading causes of death remain the same, with heart disease at the top and cancer close behind. Another report released by the CDC specifically examining maternal mortality reported an average of 17.4 maternal deaths per 100,000 live births in the United States. According to the data, racial disparity is still a serious problem there. We've talked about that before. The rate of non-Hispanic white deaths is 14.7 per 100,000, compared to a shocking 37.1 per 100,000 for black women. Also, according to these data, maternal mortality rates for Hispanic women were lowest at an average of 11.8 per 100,000. Finally, topic number 3. The FDA sent a letter to the makers of Purell hand sanitizers, warning them against some of the claims they've been making on their websites and social media accounts. One particular point the FDA is worked up about, the unsubstantiated claim that use of Purell hand sanitizer may be effective against viruses such as Ebola and the bacterium MRSA. While the website does state that no studies have tested hand sanitizers against Ebola, it then mentions that enveloped viruses, like Ebola, can be easily killed or inactivated by alcohol, making their intentions clear if not clearly stated. None of this is to say that hand sanitizers are useless, of course. They are recommended in the absence of soap and water, but we need some data before we start bringing things like Ebola into the conversation. Okay, that's it for now. If you feel so inclined, let us know if you like this format, or if you prefer the news to center, as usual, on just one topic. Hey, did you enjoy this episode? You might enjoy this other episode on how U.S. maternal mortality is much higher for African Americans. Always helps if you like and subscribe down below. And if you head on over to patreon.com/healthcaretriage and help make the show bigger and better. We'd especially like to thank our research associate Joe Sevitz and, of course, our Surgeon Admiral Sam.